Good afternoon, everyone. Thanks for joining us. My name is Lili Tenney. I'm the Director of Outreach at the Center for Health, Work, and Environment and Director of the HealthLinks program. We're happy to be hosting our 9th town hall of our series over the last few months. This is a continuation of a couple of weeks ago where we had Newman and Mike VanDyke present on return to work and had a number of questions come up that prompted us to continue the conversation here today. So thanks for joining. This will be a live discussion with the 3 experts we've invited, and we look forward to having you participate by way of Q&A. So we're really looking forward to it. This series is put on by the Center for Health, Work, and Environment by way of our HealthLinks program. The HealthLinks program works with employers across the state of Colorado and nationally on implementing a total worker health approach through providing mentorship, certification, assessment, and advising to organizations of all shapes and sizes. The center itself is one of 6 centers of excellence for total worker health and one of 18 education and research centers funded by the National Institute for Occupational Safety and Health. For some general housekeeping, as you join our webcast today, all of you have been put on mute through the duration of the presentation. So we have Katie Guthmiller, our Total Worker Health coordinator in the background. You can see her picture there, who will be moderating the chat function. So please use that if you have any technical issues. And then if you have questions for our panelists, which is the goal, use the Q&A box in the control panel on your screen. We are going to be recording this and the slides, we don't have any presentation slides, but we'll be sharing that link with you all in a follow-up email tomorrow that you can distribute and share as you wish. And at the end of the session, we'll give you enough time to complete a quick survey that really helps us in evaluating how we're doing. So let's get started with some quick introductions. On the topic itself, we're now in week 3 of official loosening of restrictions across state, local, federal guidelines for return to work. And this conversation is really focused on addressing what some of the immediate challenges for this transition are, including what we've learned in the last couple of weeks, how organizations should best prepare for what's known and what's not, and also focusing on what employers and business leaders, managers should keep in mind as the top concerns as far as employees have as returning to work across all industries and different workforces. And there's actually been a number of surveys that are being conducted on a minute-by-minute basis that are really elevating some of these for us to talk about here today. So our lineup for our expert panel is Dr. Newman, a distinguished professor in the Department of Environmental and Occupational Health and Epidemiology at the Colorado School of Public Health. We're at the University of Colorado Anschutz Medical Campus. He is the founding director of both the Center for Health, Work, and Environment, which is one of the Total Worker Health Centers, and the Mountain and Plains Education Research Center. He's also a professor of medicine in the Division of Pulmonary Sciences and Critical Care at the University of Colorado, and he's very recognized for his contributions to occupational health and safety, total worker health, lung disease prevention and treatment, beryllium health effects, medical surveillance, and intervention science. Thanks for joining us, Lee.
Thank you.
We also have Dr. Beth Carlton, who is an assistant professor in the Department of Environmental and Occupational Health at the school. She is an environmental epidemiologist who works with a multidisciplinary and multinational team of scientists to understand the ways in which social and environmental processes impact waterborne diseases. But most recently, she's been on the front lines with in the state of Colorado with our Colorado COVID-19 modeling team, and so has joined us here today to talk about what's happening on that level. And then Dr. Mike VanDyke, who is an associate professor in the department and is also the continuing education director at the Center for Health, Work, and Environment, has over 20 years of experience as an industrial hygienist, a researcher, a public health practitioner in the academic community and clinical and government levels. So he brings a lot of experience here today. So with that, I again want to remind you, I'm going to kick things off as moderator with some warm-up questions. But for all of those that are here with us today, we have about 200 participants. And so please let us know, who you are in the chat function. It'd be great to understand a little bit about who we're talking to. And then please start asking your questions in the Q&A function. Let's get things started. Beth, as part of the modeling team for the state and what you've been working on, I'm wondering if you can start by giving us the good news about where we're at as a country and as a state as far as starting to reopen businesses.
Hey, Lili, thanks for inviting me to be here today. Yeah, there is a fair amount of good news right now in that in Colorado, we were under stay-at-home orders from March 26 to April 26. And we really saw during that time an impressive decline in COVID-19. We estimate that what we call the reproductive number, or the average number of new cases generated by each case, went below 1, which is good, which means infections are declining during that period. And it looks like that trend has continued through early May. What this means is we're in a much better place now than we were in early April in the state of Colorado. Nationwide, we're also seeing declines in a lot of areas. However, in some parts of the US, including in the Southwest, infections are increasing, and that's particularly worrisome. The other good news is it's been 6 months since COVID-19 emerged, and we understand a lot more about this virus than we did in the early days of this epidemic. And I think there are a lot more tools at our disposal in terms of how to control and prevent transmission. So I think both kind of this updated understanding the science and the decline in infections in many areas is allowing this conversation that you're having about how can we start thinking about some doing some things that may have been inadvisable 6 weeks earlier.
Thank you. Lee and Mike, that's a glimmer of good news, and I think we're seeing that with a lot of the employers that are in our Health Links network, but also ones that we've been consulting with in different industries. And I'm wondering if you can speak to the approach as far as the guidelines go for starting to create internal teams to help coordinate reopen efforts in organizations, and specifically, who are the best people to have on these teams? What types of approaches are you starting to see emerge for organizations to implement guidelines in practice?
Lee, you're muted. Do you want me to take that or you, Lee? All right. I mean, I think the important thing to think about as we approach this is the more we see this, the more we see that really this issue and the response to it touches every level of an organization. So I think really putting the team together from the start that really includes and is led by leadership and management is the most important thing. And the team should include people like safety and health professionals, HR professionals, legal department, definitely should have worker representatives in this because they know really what's happening on the ground. And I really think the roles for all of these people is the same. I mean, really think about every facet of your operation. Think about where people come together, where people get closer than 6 feet together and they stay there for, minutes, 10 minutes, 15 minutes. And think about ways to reorganize your work to prevent those close contacts from happening. So it sounds simple, but I think when you see this in practice, you start to think about the many layers that this really affects in terms of coming to work, leaving work, even, what your break rooms and bathrooms look like. So I think it's really important to have all facets of your organization involved in this process. And most importantly, to really have leadership buy-in and support for everything that you're doing.
Yeah, I'd like to add to that. I think that's spot on, Mike. The things that I would add are that if you have organized labor, that the union folks should be a part of this conversation as well. I also want to add that at the table, you need to have the people who are responsible for thinking about your benefits plans. So the HR folks end up being pretty important here, because at the end of the day, the thing that I think we've all learned is that we need to be setting up conditions of work so that workers are feel that it's actually part of their responsibility, and that they won't be in some way penalized if they have symptoms and stay out of work because they know that they may be at risk of infecting others. And that really comes down to issues like, are you providing people with the sick leave protections? If they have to be quarantined, is their job still there when they get back? Are they receiving any benefits during that time? So that's an important component of, I think, controlling the flow of potential cases of people who are potentially infectious coming back into the workplace.
So as these teams start to form, what are some of the basic or baseline expectations that organizations should be implementing for their COVID teams?
Lee, you want to start this time?
Well, I think that for starters, I want to remind people, or if you're not familiar with it, there is something that those of us in occupational health refer to as the hierarchy of controls. And so what I like to do is have those folks on any kind of health, wellness, and safety committee or team, even before COVID and after COVID, thinking through, what are the hazards? How do we eliminate exposure to those hazards? How do we create substitute conditions to protect people? What kinds of engineering controls can we implement? What are the administrative controls, like I just touched on, like the distancing rules, et cetera? What kind of PPE is necessary? And what kind of education do people need to have? And that hierarchy is a good framework for organizing committees' tasks.
And I'd just like to add to that, especially on the education side of this thing. I think one of the most overlooked things is really making sure that you educate employees about COVID itself, how it spreads, signs and symptoms. Don't assume that employees have been watching the news and they know all of this. It's really important that there's an effort that goes out to really get that information out there as to how it spreads, why they should be wearing masks, why they should wash their hands. All of those things are really important.
Thanks. And that leads me to one of the biggest questions as far as the new normalization of this in workplaces goes. And Beth, I'm going to direct this question to you, and it's regarding social distancing and encouraging. We know that encouraging social distancing is different than enforcing it. So what do you feel is essential versus ideal as far as social distancing in the workplace goes at this phase?
So I think what's clear is that COVID-19 thrives on people being really close together. And to have a transmission event, you need somebody who is what we call susceptible. They haven't been infected, coming in contact with someone who's infectious, who may or may not be having symptoms. Hopefully, there's, as we mentioned, a sick policy that keeps all the symptomatic people out of the workplace for that, that period while they're infectious, but you may have asymptomatic carriers. So you want to think about trying to minimize potential close interactions between people. I think about this as people, space, time, and place. So how many people are you going to come in contact with? Can you maintain at least 6 feet of distancing, and more is better in that context? How long are people going to be in contact with each other? The longer people are in close quarters together, the more likely there is to be a transmission event, right? So you can think about having a chance encounter in the hallway versus sitting right next to each other in 2 cubes. And lastly, place. Ideally, we know that transmission risk is lower outside. And if you think about indoor environments, is there sound ventilation? Is there a way to deal with indoor air quality and change issues? So all that to say, I think that the biggest focus should be minimizing the number of close contacts each individual in the workforce has with others as much as that is possible. I am frankly far less worried by people walking by each other in the hallway for a minute, and far more concerned about a bunch of people in a conference room or in a warehouse in really close conditions.
Well, that's a great segue into the next question that I was going to ask. And actually, we've had a couple questions come in regarding some different work settings. So as far as the guidelines go around clinical settings, there's a question that a participant has around, is there such a thing as too safe? When and which occupations should we hand out N95 masks to people, since it is quite a commodity?
So since it has the words "too safe" in it, that's probably mine.
Okay,
So,
Mike, you take this one.
if you're asking a safety professional if it's ever too safe, that's a loaded question. But I think the question is good, as to when do we need N95s and when do we not need N95s? And I think there's a lot of emerging research out there really showing that, we need to rethink industrial hygiene slightly. I mean, normally we're thinking about personal protective equipment, putting this on the person who's being exposed. To quote Lee Newman, I think we need to switch our focus and think about turning off the tap. So turning off the tap is all about putting a face mask on somebody who could potentially be expelling virus-laden particles by speaking, by coughing, by those things. And I think that's a paradigm shift. But I do think that a lot of the data coming out is showing that, masks can be really effective in reducing the viral load in the environment and reducing the possibility of infection. So I think in an environment like, other than healthcare, where you have aerosol generating procedures with people with COVID, I'm not sure that an N95 is necessary in other environments. So I think as long as you can really enforce people wearing, fairly high quality masks, multiple layer fabric masks, surgical masks that fit pretty well, that cover the nose and mouth, and you can maintain distance, I think it's a relatively safe environment.
Lee, did you have anything, or Beth, do you have anything to add on that?
Yeah, the thing I'd add, just to sort of finish my metaphor, if you don't want to get wet, turn off the tap. And I think it definitely applies here. I think the thing, Mike, that maybe to follow up on is, and we were just reviewing a paper together yesterday in the Journal Club talking about, how much protection you can receive from different types of masks. And my takeaway from that was that you get you as the person wearing the mask, protecting others by wearing a mask, can do a lot with, number one, almost any kind of mask you're wearing. Number two, you can do even better if it's a surgical mask. And number three, you'll gain even more ability to protect others if you're wearing a well-fitted N95. All of this predicated on people wearing them appropriately, wearing them correctly, knowing how to wear them.
And actually wearing them.
And actually wearing them.
So let's pivot to a different type of work environment. And Lee, I want you to kick this one off, because we work with a number of office-based organizations. And what we've seen and actually encouraged over the last 10 to 15 years is that these workplaces, work environments actually start to have started to have more open offices. Our own offices are designed as such to encourage collaboration and light and a nice atmosphere to work. So coupled with shared common areas, what's going to need to change to keep employees safe as far as these open offices go?
Yeah, I think we're going to be, and people are already thinking very hard about how to retrofit these very open design offices to create barriers, things that will, give you a, if you will, at least a reminder, if not a physical barrier, to keep your distance from others. Because I think that we're going to be keeping our distance from each other for a long time to come. Having control over the ventilation system, you would hope would be a way of helping to address this, but wrestling the control over the ventilation of a space in many office buildings is easier said than done. And Mike, I'd love your thoughts about that. I think that we're going to find that people are relying more on administrative control. So having shifts of workers where we reduce the number of people who are coming into that workplace at any given time to reduce the collisions.
Mm-hmm.
It's contrary to the way that we were thinking when we designed open space offices, because we wanted collisionable space, because that's where the ideas and the innovation and the interactions that lead to successful organizations comes from. So we're going to have to rethink the way that we engage in order to still have the creativity, innovation, and agility to create better products and services as companies. But in the meantime, we have to start by figuring out some of these mechanics of keeping people safer in those kinds of open office designs. Will we go back to everybody having their own private office? I think more likely what we're going to do in terms of office spaces is sticking with having more people working remotely in the long term, rather than trying to figure out how do we retrofit them all back into the cubic feet that we had.
Right. And that in itself seems like an unanswered question. As far as the guidance that's been given, there are some examples of having some percentages and allocations to the amount of employees that are considered safe to return to the physical work environment. And organizations are assessing that and providing different options in different ways. And first and foremost, I think it's been, there's consensus that any working activity that can be effectively accomplished remotely should continue to be done remotely, as far as what employers are doing and how they're communicating that to employees. That leaves some vagueness around providing options. And I'm wondering if any of you, all of you, have thoughts on or opinions on how that should best be assessed, as far as how long we extend remote work, how that should be factored into this equation?
I mean, I think that it depends on the organization. That's always the best answer. It depends, right? But I think that, you really need to assess, are people able to be productive at home? And I think there are other factors that come into it as well. I mean, there are some instances where mental health becomes an issue with extended periods at home. So I think we need to take all facets of this into account and really try to be responsive to employees the best that we can, while also making sure that, as a business, we could maintain our level of productivity. So I don't think there's a set answer for that. It's the hard thing.
I'm glad that you raised the mental health issue, Mike, because I think that it's also one of the things that's become an impetus for trying to figure out how to get people back where they feel that they can be with their work friends, where they are able to see people face to face instead of through a Zoom. And the meaning of that for people's mental health. From the very beginning of this, very early on, I was saying that we shouldn't be tracking COVID infections. We should be relating COVID-related illnesses, because the illnesses and the worsening of health conditions that we're now starting to catalog, including the impacts on mental health, on behavioral health, is a significant, unfortunate byproduct illness related to COVID. Can I just jump in here for a second, Lili, because it's back to this business about the office space. I had noticed that there were a couple of real nuts and bolts kinds of questions, which I think we probably
get to the mechanics.
Yeah, the mechanics. So Jill is asking, with cubicles, should we install plexiglass above the cube walls, and also with workers who are in rows, and when you have employees in front of and in back of each other, do we need to shift it so that there's no one behind or in front of me? And I just want to comment on the second one. Back to my analogy, if you don't want to get wet, turn off the tap. Well, if you don't want to get wet, point the hose somewhere else. So, and Mike, maybe you want to comment about both of those in terms of the practicalities of, where we're pointing our aerosols and our droplets, and how do we keep them in a cube as opposed to outside the cube?
Yeah, and I think that's important on lots of facets of office design, is that, directionality is important. The further you are away from somebody who might be expelling viral particles, the lower the concentration in the air is and the less you're going to breathe. So if you are back to back, your exposure is going to be much less than if you're face to face. If you install a barrier and you force the air to take a longer pathway, your exposure is going to be less as if there's no barrier there. So I think both of those things are good ideas.
Sorry to interrupt, but just to touch on that, so an example of that would be in a cubicle setting, installing plexiglass above the walls.
So I would say what you need to do is, if you are spending if you are in a seated position and your cubicle wall is lower than your nose and mouth, a plexiglass barrier, and there's somebody sitting at the cubicle across from you, installing a barrier that extends above your head when you're at the seated position will increase the length of air path between you and the person across from you, which will serve to decrease your potential exposure. Now, a better solution is to move the person that's sitting directly across from you to another cubicle. But if that's not possible, barriers do help.
And what about other workplaces, work environments like the bathrooms? There's a question from Christy Dittmar about whether or not there should be a concern that a spray from a flush toilet can cause droplets containing virus to be released and spread. Beth and Mike, do you want to touch on that?
Beth, it's water. That sounds like your question.
Poop is my domain. Thank you. So at the moment, what we know is that there are viral DNA is shed in people's stool, but it's less clear whether there's actual infectious virus shed in stool. So that remains one of these frustratingly unresolved questions right now. What I will say, and I'm sorry this is gross, but if you flush the toilet with your own stool in it, that spray can only come from you. So whatever you have is what you'll be exposed to. And I think the way that bathrooms are designed, the risk of you being exposed to anyone else's stool is fairly low. So that would be a low concern. What I'd be much more concerned about in bathrooms or other confined spaces is if the bathroom is very small and you have multiple people in that space. They're not going to have a lot of time in that space, but there could be a lot of people passing through. And that's what's more concerning. And that's where I think there's been some discussion about kind of limiting the number of people in the bathroom at a given time, which would be important.
And same would go for common, like hallways, stairways, vestibules, right?
Yeah, I mean, if you think about the concentration of a virus in a space, the smaller the space you have as a box, the smaller the box, the higher the concentration will be. Mm-hmm. So if you have a giant stairwell, that's a huge stack, in some ways there should be on average a lower concentration than in a small bathroom. So it's those really small spaces that we're most worried about. I know some offices have these kind of micro breakout rooms that can fit like 2 or 3 people. You don't have a lot of people in those rooms, but those people are potentially very close together, and there's not a lot of air in that room so that the concentration can build up in that space. I don't know if Mike or Lee, if you want to add on to that.
Mike, I was hoping you could comment on ventilation. Lee, you noted that, and there's a question of whether ventilation should be increased or decreased in open office situations. Mike, you want to take that?
Yeah, I mean, I think first of all, we need to acknowledge that you can't, in most systems, you can't extensively increase ventilation without a lot of money and a lot of design changes. But there are some simple things that you can do to increase ventilation in a space. The first thing is the engineers can adjust the system to ensure that the maximum amount of outdoor air is being brought in. And that will increase the air change rate in the space, and it will decrease the concentration of potential virus particles quicker in the environment. The second thing they could do that people should really be thinking about is after employees leave, a lot of times for energy reasons, people shut down their system. So they don't run their system 24 hours a day. If you have employees in a building running a system for several hours after the employees leave, will also help to eliminate viral particles from the building. So I think those are 2 simple things that can be done. Now, if there is definitely benefit in getting a lot more air changes in a space, it's just not always possible. The other thing is to think about fans. There's been a lot of talk about fans in offices, and we talked about, Lee's analogy with the hose. We also don't want to put the fan in front of the hose and blow the particles a different direction so that they go directly onto somebody else. Mm-hmm. So making sure that you're not blowing fans across people, spreading those particles that people are expelling is also important. So that answer most of those questions?
Yeah, that's great. And what about cleaning? We've had a couple of questions come in. So whether it's the bathrooms or whether it's the small conference room or small phone booth, what are the cleaning precautions that should be taken to make sure the space is safer between users?
Well, I mean, ideally what you'd want to see is every surface clean between all users. I'm not sure how realistic that is in an office environment, but that's the ideal situation. I think what you see is that at a minimum, what you'd like to see is that a person cleans their personal workspace once a day, and that high touch work surfaces, doorknobs, handles, break room areas are cleaned multiple times a day. Maybe not necessarily after every user, but multiple times a day. And then making sure that people understand how to clean properly, that they understand that, when you spray a disinfectant on a surface, there's a contact time. It needs to stay on that surface for the number of seconds that are listed on the bottle. So training about proper cleaning is also important.
Hey, Mike, do you want to extend that to what happens when the FedEx person shows up and we've got mail and boxes and packages coming in? What do we do?
That's kind of the same thing as groceries, right? People have been talking about that a lot. And I think that really, you know, the potential viral load on a surface like that is generally pretty low. I think it's a much better strategy to think about washing your hands after you handle those things than to think about disinfecting every piece of mail or every package that comes into a facility. And, you know, all of us need to continue to remember, you know, don't touch our face with our hands. That's a really hard thing to do, but, you know, that's what we need to be doing.
And soap and water is a really good thing, right?
Soap and water, I mean, for the most part, soap and water is a really good cleaner. You can usually, I mean, except when we talk about bathroom surfaces and things like that, generally soap and water works almost as well as a disinfectant as long as it's used properly.
Hey Lee, can I ask you to put on your manager hat for a moment here?
Okay.
We've had a couple of questions that are starting to raise the issues that employees have, the concerns that employees have with different levels of comfort around whether it's being around other people, being in different situations. And I'm wondering if you could speak from a leadership perspective as far as how to manage the different levels of comfort that employees are going to have.
Boy, this is really tough because, and I don't think that there are simple answers to this, Lili. So thank you for that question. Here are the kinds of things that we're already hearing about and that we're even experiencing in our own office. We have people who have already been told and know that they are at higher risk than others. We don't know who in our workforce is particularly being harmed in terms of their stress levels, their mental health, even their risk for depression and anxiety by either being kept at home too long if they're working from home, or being required and expected to show up in a workplace where we cannot 100% guarantee safety. So this is almost it's almost an impossible question to answer without doing a couple of things first, and then you still won't have a perfect answer. One is to find a way to engage the people who are going to be in that workforce to understand what do they see to be their concerns and the barriers to returning, and also what they see to be the reasons why they want to return. And you have to be careful as a manager because you can't be soliciting from them personal health information. I can't be saying, oh, do you want to come back to work because you are depressed working from home? I can't ask you that. But I can ask people what would be the kinds of things that we should be doing to create a workplace where you would want to come back to work and feel safe at work. What are the precautions that we should be taking? And to be sharing that, as we started out much earlier, talking about having the right teams put together to be gathering that kind of information. I'm not going to give you a straight answer to it because there's not a straight up answer to this question. But I think that we have to respect that we're going to have people across a whole range. I'm personally considered high risk. I'm going to, because I'm going to work from home probably as long as I reasonably can. Mm-hmm. Somebody else might say, well, yeah, I'm also at high risk, but you know, I need to be in the workplace and I'm going to find a way to get back sooner. Those are going to be equations that nobody can solve without taking the individual and their own fears and concerns and seriousness about protection into account.
I think those are all really important points. And I know you're not a lawyer, but you're a doctor. And I'm wondering if you can can speak to whether or not there will be legal implications if the employer does require an employee to return to work.
Well, I'm sure that that's already starting to play out, and the if you look at the kinds of guidances coming out of in the U.S. the EEOC in terms of equal opportunity, and whether the decisions we're making about requiring people to come back to work, or requiring them to not come into work, or requiring them to have face time with people who are not adequately protected. There are a lot of facets to that which are a setup for discriminatory practices. And frankly, the entire COVID response that we've seen has created already some potentially discriminatory practices. We're requiring certain people to be on a job even facing a hazard which we cannot guarantee protection from, but they're required to work. And those people will tend to be people, and have tended to be people who are who need the paycheck, who are already potentially vulnerable, and who may even be at higher risk of bad health outcomes if they do get infected. So we're already into a serious societal mess in terms of setting up conditions that have really been rife with the risk of discriminating against certain people in our country.
Can I just add on? I think that a lot of these questions, the legal questions, are really unsettled at this point. Mm-hmm. But I think that this is really becoming a hot issue just over the last couple of days around workers' compensation and COVID, and what level of evidence is required to prove that you contracted COVID at work versus COVID in the community. And I think you're going to see, at least in Colorado, you're going to see some state level legislation shortly, or at least the attempt at state level legislation on this issue. And I think nationally as well. So I think, stay closely tuned on this one, because a lot is happening on that issue.
Okay, great. And we're going to actually have partners from Pinnacle Assurance, the Colorado state-based workers' comp insurer, join us in a couple of weeks, including someone from their legal team. So hopefully that will enlighten us on some of those issues. Are there any requirements around reporting employees who test positive for COVID currently?
So the requirements for reporting an employee that tests positive, and I'm talking under OSHA regulations specifically. You follow the same guidelines that you follow for any other injury, where you make the determination of whether this was caused or exacerbated by work. So it's an employer responsibility to determine that. It gets reported on your OSHA 200 log for many organizations, for those organizations that are required to report. In terms of workers' comp, I think that many organizations are reporting these as a first report of injury, but how it gets adjudicated later, those are a lot of those are still in the works, so it's hard to say what happens.
Related to that, and I don't know if this is part of your question, Lili, is this whole issue of what should be an employer's responsibility in terms of doing testing and communicating when they know that a worker in their facility or in their business is a suspected or diagnosed case with COVID. And I don't know if Beth and Mike, if you have some thoughts about this particular issue, because it's definitely coming up. We're in this place of going like, well, we want to do testing. Well, who's responsible for testing? Who gets the results? How can we use that information to protect others in the workplace? Because in this case, the hazard in the workplace is one of the employees.
Right.
So where do we go with that? And this is another one that it's coming up a lot, and it's not a clean answer.
So hold on, I can't see Beth very good. She's covered up with a bunch of windows here. Before I give Beth a chance, I just wanted to add, I was really wearing my worker health hat when I talked about OSHA, and I forgot to talk about public health. And if you do have a case of COVID in your workplace, you are required to report that to your local public health agency. And if you have 2 cases, at least in Colorado, they're going to come do an investigation and they're going to do the contact tracing at your facility. Beth, do you want to extend on that, or you want me to?
I mean, I think that was primarily what I was going to say. There is an obligation to report if there is a case. And, you know, if we go back to just basic clinical ethics, you know, there's obviously an obligation to tell the person who's positive. That goes without saying. I think given, you know, the amount of fear right now around the disease, and Lee may have thoughts on how to do this well, I do think there's ways in which, you know, you have to navigate this delicate balancing act of protecting people's privacy and assuaging, you know, helping people feel like they have the information they want to respond. And, you know, states are moving towards contact tracing, and what that means is that if you do have a case, there will be questions about who that case has come in contact with, and those people who had contact with those individuals will likely be subject to quarantine. And it's probably worth having a conversation about that before it happens, so that when and if it does occur, there are protocols in place to handle that. Because I think quarantine is an incredibly powerful way to prevent the spread of infection. It is also very disruptive to people's individual lives, the thought that you cannot leave your home for 14 days. And so working to try to think about how you might support individuals in that situation.
And Beth, would that be the same for an employee who lives with someone or has a family member who's been infected?
Yeah, so every state is rolling out contact tracing a little bit differently, but the bare bones is that if somebody has test positive, the goal is to identify their contacts, and the way they can be identified is 2 ways: either through kind of interviewing people about their contacts, so their household members would almost immediately be subject to quarantine orders, and any coworkers that they had contact with would likely be quarantined. Some places have adopted this digital contact tracing. This has happened in South Korea, and that is more nuanced in that it gets at if you were at the grocery store and in line near somebody, they might be contact traced. In Colorado, that is unlikely to be happening in the short term. It's much more about your household and kind of known contacts at work.
So I want to add on to that too. And, you know, we're thinking about this in the lens of workplace health and safety. And with every workplace safety and health incident or injury, we have a responsibility to investigate that injury, to determine the root cause, to determine what could be done to prevent these things. COVID is really no different than any of these things. If you have a case in your workplace, you need to investigate it to determine what were the policies, what were the actions, what happened, and how could that be prevented in the future. I think it's ultimately important that we all acknowledge that, you know, we're suggesting lots of prevention strategies, but yet, you know, this virus has only been around for 6 months. We really have no idea how effective these strategies are going to be. In theory, and in a short little bit of practice, some of these things seem to be working. But evaluation of these strategies in your particular workplace through investigation of these cases is critically important.
And so, Mike, as the saying goes, you can never be too safe. Is it a one and done testing scenario, or in particular jobs that have a high level of contact between people, restaurants, grocery stores, should employers be trying to do more routine testing? And that comes from Candace.
Do
you want to talk testing? You like testing?
Well, I like talking about it, but let's talk about where we are today. And anything I say right now could be different in a minute because things are changing so fast. And Beth, I really want you to weigh in here as well. Let's talk about the value of doing PCR testing. It's useful in order to confirm that somebody has a case. That's clear. Should we be testing everybody in every workplace? That's the approach that's being used by some organizations. I don't know that makes a lot of sense in terms of either the use of the resource or, frankly, how we deal with the false positive tests and the false negative tests that you're still going to have, especially if you have a very few people in your workplace who are truly sick. But that's probably there's use for PCR testing, and there's particularly use for employers to know that somebody who has been suspected with the disease, that there is somebody from their workplace who is positive on PCR testing, because that's how, as Mike said, that's the information that an employer needs to go back and do their root cause analysis and figure out, where could we try to improve the way that people interact, the spaces that they share, the separations, the engineering controls, et cetera. Antibody testing is a different deal. Antibody testing at this point, I cannot see a use for antibody testing in the workplace. I know there's conversation about, could we identify people who have immunity, and because they are immune, we can put them on the front lines of interacting with the public, for example, with other people who may be infectious. That's an interesting idea, an interesting concept. I don't see it going anywhere anytime soon for a number of reasons. First of all, we do not know right now what kind of a titer you need, how much of an antibody you need in your bloodstream to be protective. We don't know if the antibody, we have to know whether the antibody is neutralizing, meaning that it can actually stop the infection. And we don't yet know whether, if you have sufficient antibodies, how long you're protected from getting infected again, or if you can get infected again. So there's still a lot of uncertainties about antibody use. The one that I think is going to be interesting to watch is going to be the antigen tests. And right now, the antigen tests aren't worth doing, but if we can come up with a point of care, almost real time test for the presence of the antigen, which marks that your body has COVID in it, doesn't prove infection, but if we can have a real-time marker, that can shorten the time between when we know someone's positive and the contact tracing that we need to do and the isolation that we need to do. It may also be a tool for addressing the concern about asymptomatic carriers. Remembering that both of those tests, the PCR test, the antibody test, and the antigen test, none of those actually tell you whether the bugs that you're detecting in somebody are still infectious or not. So these are some of the struggles that we have with the testing now. I think these are going to be the things to watch. I'm particularly holding out for seeing where we go with more real-time point of care testing. And I wouldn't do antibody testing at all in the workplace right now. I do not see its utility right now. Beth, do you have a thought about this?
I think the one place in Colorado where regular testing is being rolled out is in long-term care facilities for the asymptomatic workers. So there's a healthcare screen every day for the workers, and they are now being tested weekly for COVID-19. And that's actually picking up a fair number of infections and trying to prevent workers from spreading infections to other workers in the facility as well as to residents. But that, I think, is kind of an extreme example. You have this highly vulnerable population and a population of workers whose job, in most cases, is to have close physical contact with the patients. And so I think that type of example you may see in certain environments, but that would be the exception rather than a rule. In a normal office place, I completely agree with what Lee is saying, that it's probably not currently advisable. Good use of resources.
I'll add one more example that you triggered for me. Let's say that you have, you could put a group of workers into a team, into a bubble, and have them be protected from the rest of society and for the period of time that they need to do their work. You could design a testing protocol where you say, we're putting you all, we're going to house you separately. We are going to test you all on day 1. We're going to test you again on day 3 or day 5. If we find anybody who's positive, you'll be isolated from the rest of the group until you've completed quarantine. But the rest of you will just report symptoms if you have any, but we're going to end up with a kind of a purified workforce that can do their job. And an example of that it has come up. It's actually in the New York Times today. I'm proud to say my daughter-in-law was quoted in the New York Times talking about collegiate athletes and the idea of doing exactly that. Let's take the collegiate athletes and put them in a bubble, and we'll do a run-in of testing in order to make sure that they are all clear of COVID. So there may be some creative solutions like that that we find for some groups of essential workers.
Well, I want to take a couple, we have time for one more question. And I want to let those of you know that have asked questions where we haven't had time to answer them, that we're happy to follow up with you. I'm going to provide my email, and we are I'm happy to pass those along to Mike or Beth or Lee so that we can make sure those get answered. I do want to ask one question, and this has to do with employee involvement and voice, and it's about do you have any general advice for those that are in mid-management and feel that they don't have much of a say as far as how the organization is handling the situation? So kind of bringing it back up to that level of leadership.
Yeah, I'm a middle manager, and I'll tell you that this is not a new problem. Occupational safety and health issues, where you see them, and even the concerns of our teams that we may be the foreman or we may be the team lead for, and getting those heard at a senior level is not a new challenge. I think that if anything, this is an opportunity, if you feel so bold, to be proposing to senior managers above your pay grade that this is a time to be rethinking how the lines of communication run within our organization. It's clearly a great time of disruption, and let's take advantage of that time of disruption to invent better ways of communicating the needs of the organization up and down. I know it's not a precise answer, but I would give that a shot and use COVID as, if you will, the rationale for proposing different ways that we communicate those mid-level concerns up.
Well, I think it's an important point to end, and I think we'll continue to have a lot of questions moving forward. And I want to thank each and every one of you, Mike, and Beth, and Lee, for your answers here today and your thoughtful conversation. Did any of you want to end with a parting thought for our attendees here today before we jump off?
I will. And I would just say that, guidance is getting updated every day. And more recently, there's been a huge amount published on the CDC and OSHA websites in terms of industry-specific guidance. So guidance that wasn't there before is now there. It seems to change every day. So do your best to kind of reach out and look at those sources, because there's some good information there.
And I'll just add on that, it could be overwhelming. Many of you still have a day job in addition to your COVID job now. Keeping track of this can really be tough to do. Reach out to us. We're trying to make ourselves as available as possible to companies, to individuals, to industries, to agencies. We'll keep working with you as best we can.
Great. Beth?
And I think to Mike's point and Lee's point, the guidance will change over time because our understanding of this newly emerged virus is changing as well. And hopefully that may make some things easier in the future, but I think it's important to be aware of what what you may be recommended to do now may be different than what's recommended in the future. And so I think we're all gonna have to be nimble in the months to come.
Thank you. So as Lee mentioned, we are here for providing any advice we can. We're going to be hosting our next town hall on Tuesday with a group out of the state of Colorado that's band together through industry, government, public health to create some new resources around reopening organizations. They've got some very practical tools. So we've got David Zagunda and Mary Logston who will be joining us to talk about that initiative. And I think it applies not only to those of you that are doing business in Colorado, but definitely able to apply this to other states. And also, we are providing no-cost advising on these different issues and different guidelines. So the best way to get in touch with us is to send us an email at contact@healthlinkcertified.org, or you can Google any of us and find our emails on our website. And we'd be happy to continue this conversation and provide any help we can. So thank you again for tuning in, and thank you so much to Beth and to Lee and to Mike for your time today. Please take the next minute before you stand up and stretch to give us some feedback, and thanks again for tuning in. See you next week.
Thank you, Lili, for moderating.
Thank you, Lili.
Bye, everybody.